Hi, everybody. I'm Wendy Murdoch, and this is Webinars with Wendy. I've been doing a series of webinars during the pandemic, and we're coming up on 1 year of me being off the road, which is an amazing thing in itself. Yeah, it's. I think it was the second week in March that I came home, and all this started for me. So, but that's okay because we've been able to do the webinars, and it's just been really great fun and learning and meeting people and seeing people that I wouldn't normally see because they're on the other side of the earth. Before we get started with Robyn's webinar, I just want to remind everybody, this is week 5 of our 5 weeks of Surefoot giveaways because of our 5th anniversary. And so just go to Fans of Surefoot or the Surefoot Facebook page and enter. And then in week 6, we're going to figure out how to let you all know if you've entered all the other 5 weeks so that you're eligible for the grand prize drawing in week 6. So we'll be putting up information about that when we get to the end of this week. So stay tuned. It's been really exciting, and it's so much fun to read about so many people enjoying Surefoot with their horses and the help that it's been. So it's really gratifying to see that all this hard work is paying off for horses, and it's fantastic. So today my guest is Robyn Larson. She's from Australia, which is why we're broadcasting at 6 o'clock tonight. And I'm gonna let Robyn introduce herself. She's a really cool person, and we met a year and a half ago now, right?
Yeah, something like that. It seems like a long time.
It feels like forever. It's so weird when you think it's like not forever, but anyway, Robyn, thank you so much for joining me tonight.
Thank you, Wendy. Okay, so I'm Robyn. My business is called Equine Miracle. I've been a therapist for horses for I think about 17 years. Prior to that, I was a professional rider and trainer and came up through the ranks as a lowly groom and manure picker-upper, as a lot of us did. So I've kind of understood horses right from the feet up, really. You know, I started as a groom and then moved on into riding, and then when I started starting horses for myself as a living is when my perceptions really began to change about horses, because I was able to throw out everyone else's ideas and just work with what I wanted to do. And that's also when I became more and more interested. I've always had therapy done on my horses since I was about 15, seen many different things, many different people work. I've been lucky as a therapist myself to be mentored and helped by people like Dr. Ian Bidstrup, Sharon May Davis, Ruth from Equinology, etc. So I've had some fantastic people helping me. So that as I was starting horses for myself and my own business, I started doing more and more therapy with them and seeing that different ways of working with horses would affect the horses' bodies in different ways too. And the connection with Wendy came when I'd had a session with a chiropractor for myself, and she had used wedges underneath me to alter my pelvis. And I thought, why don't we have something like that for horses? Because pelvic issues was something that I could fix them, but only in the short term. And the horse's pelvis would kind of return back to where it was. And it was a bit of work to get all those structures to let go and release, etc. So I came home and I Googled wedges to see if I could find something for horses to stand on. And that was when the connection came up with Wendy. And that very night, as I was Googling, I emailed Wendy about, okay, I'm going to buy these things. Which ones should I buy? And she must have been sitting at her computer, because she emailed me straight back and we had this whole conversation. I ended up buying the whole kit in one go. And yeah, absolutely never looked back, never regretted it. And now I'm the 4-hoof in Australia. I should put my pin on. Hey, that's not a pin, it's a magnet. Just to confuse everyone, it needs to come with its own video on how to use it.
Apparently. It's a magnet. So my staff, including Joe, decided that having a regular pin might be dangerous around horses. So they opted, told me to get the magnet. So I did, but you know, sometimes changes just
It's a great idea, but even I didn't work out. I realized it was a magnet. I stuck it to my fridge. So anyway, I do wear it now when I remember, and I very proudly will be wearing it this weekend when I teach my first ever Surefoot practitioners clinic. So that's very exciting. All right.
Well, and what I remember from all that is as soon as you got your pads, you went to that endurance ride, the Shahrazad. And you called me up after that. We Skyped because you were so excited about what you'd seen with the horse there.
Oh gosh, I don't even remember that. But yes, Shahrazad has been my proving ground for a lot of things, including the pads and the vet can take, because it's a 400-kilometre ride over 5 days. The horses do 2 legs each day, and they need quite a lot of management to get them through. So it's a lot of horses I'm looking after. I don't look after them all, but they're in a really high pressure situation, and they come in and you look after them and they go back out again, and then they come back in, and you get to see, did what I do did work or not? And so, yeah, we found at Shahrazad, the Surefoot pads definitely seem to have an influence on bringing the horse's heart rate down more quickly. And the owners were reporting to me the horses were way more relaxed than they normally would be at that ride. But the other thing was, these endurance horses, they wouldn't get off the pads. I would have to literally like dragging them off. No, that's enough. And I have to go and put these under another horse. Yeah. So if Arabians are going to do that, well, they are pretty smart, but yeah, I've forgotten about that.
Yeah, no, that was because I remember exactly where I was when we called. I was actually in Catlett, Virginia, I wasn't home. And I sat in my car and we chatted for about a half an hour. And it was really, really cool, really exciting.
Yeah.
So tonight we've had a slight change of topic. Do you want to kind of, just in general, mention what we were going to talk about and then what we are going to talk about?
Okay, so we're going to talk about ECVM, or equine complex vertebral malformation, which is something that, well, I've known about for about 17 years since I became a therapist. And Sharon May Davis began, well, she didn't begin her research then. Her research began long before then, but it was really around the time when the research became public. And I have been involved in quite a lot of that research in a hands-on and, you know, providing numbers, etc. And it's something that has become world known around the world, although not as well known in some countries as others. And I feel that there might be a bit of confusion about it. So I wanted to talk a little bit about things you might see that would make you think that your horse might have a neurological problem or a neck issue. And then if your horse had been diagnosed with ECVM, some of the things that I've seen when I've worked in conjunction with vets that might help the horse to be able to do some sort of low-level activity. However, I've been told it's not appropriate for me to talk about at the moment, and that's completely fine. I'm not a veterinarian, so we're going to give you a taste of something else instead.
Yeah, and so just to be clear, this is something that you've seen working with Sharon May Davis, and there's study going on about it right now, and there's research going on, and I believe there's a genetic component that people are starting to track. Is that right?
Yes, so there is a website now, ECVM All Breeds, and the main reason to start that website was to begin to collate a database of horses that have ECVM, because the genetic link has been proven, and that way we can start to track where it is and perhaps do something about reducing the numbers of horses being bred with this problem. And also for people who are breeding high performance horses, they don't want to breed them with ECVM. So horses that are to be listed on the ECVM All Breeds website must be diagnosed first. It can't just be a guess. But that's the idea, to start to bring together a database, because it does appear to be across a lot of different breeds in the world.
Right. And of course, you know, it's so important to get a good diagnosis whenever you have a horse that, you know, is showing symptoms of not poor performance or behavior issues that aren't just your typical behavior issues. And we can't emphasize enough the need to make sure that you talk with your vet, have your vet look at your horse and work out a diagnosis, because so many times when people hear about something and it comes down the pike, you know, we tend to have this sort of, you know, over exuberance about it and thinking it's everywhere. And I can remember many, many years ago, this was back in the 90s when I was going to New Zealand every winter. And I would follow from North Island to South Island this train of the sort of the flavor of the winter. It was my winter, their summer, but you know, all the horses had something similar. And so we tend to kind of latch on when we can't understand something, we kind of latch on to something that might explain it. But without a really good diagnosis, having, you know, x-rays and your vet evaluate your horse, there's a lot of times when there's similar patterns, but different causes. And I think Robyn.
Absolutely. Yeah, absolutely. And years ago, I did an online course. I even had them years ago with Dr. Eleanor Callan. It was about neurological or muscular disorders. And one of the things that I learned a lot from that course, but one of the big take-home messages for me was that pain can mimic a neurological problem. So, and often if you have a neurological problem, there will be a lot of pain associated with it because of the dysfunction. So it's really incredibly important to get someone who is qualified to make that differentiate, make that diagnosis for you, because otherwise I feel that perhaps a lot of horses that actually have painful conditions and lamenesses are not getting the appropriate treatment because someone thinks it's a neurological problem that doesn't, you know, that's not qualified to give that diagnosis. So it's really important.
Yeah.
Really important.
You know, horses only have so many ways of showing us that something's going on, and unfortunately, they can't say it's right here. You know, even when we talk to people, we don't always get the honesty.
Where it started is the thing you mostly want to know, don't you? Where was the first pain or whatever? And often even in people, we can't remember that because there's been this whole cascade of things that have happened. And so it's more difficult with the horse, and it's something that I have actually become very, very good at, which is peeling back those layers and finding where's our primary cause and getting the horse to the right qualified help if I can't help it. But, you know, that's a whole lifetime with horses. Yeah, as well as working with some great veterinarians, etc.
Yep. So that said, we're going to talk about what tonight?
Okay, so read the title of my PowerPoint here. I'll just move you over a bit. Releasing tight muscles and fascia. Okay. So I'm just going to look at my monitor, so I'm going to be slide on to you guys.
All right, well, go ahead and share your screen. We can see it.
Oh, yeah, okay, sure. I forgot we'd stop sharing. Okay, there we go.
There we go.
So I have a group on Facebook, and I had a hip replacement last year. So I said to my group, is there anything you would like to know about? And I'll put together something, you know, while I'm off work with my hip replacement. Little did I know how busy I would be with the hip replacement, but anyway.
How's it going?
Oh, it's fantastic.
Good.
Thank you. Oh, we're not quite 3 months afterwards. I'm so pleased I had it done. I'm so much better than I was. Unbelievable. So yeah, don't put it off. It's amazing. So anyway, one of the questions was about what can we do to release tight muscles in our horses. So if you ask me a question like that, you're never going to get a simple answer, I'm afraid. But this is the PowerPoint I came up with. Now, it does go for a bit longer than Wendy's remit, so I'm going to go through it quickly. And I've got some videos in here which I'm not going to play But you'll be able to look at this webinar on Wendy's website and then play those videos, or find the links, or you can note them down or whatever and go and look at them for yourself.
Yeah, we can put that in the description if you send me the links. I can.
Yeah, so I'm happy to answer questions. I think you usually get them in the little chat box. Do you, Wendy? Is that how that works?
I can monitor the Q&A in the chat if anybody has any questions as we go along, and then where it seems appropriate, I'll ask those questions.
Cool. Okay, so let's go. All right. Move. All right. So I'm not sure that that's, excuse me, I've marked this up already. Oh, no, that was the right one. So I should be, what have I done? All right, so the first thing, if you want to release tight muscles in your horse, you need to understand what is the underlying cause. That's the most important thing to do. Yep, we can all do a bit of massage and we can do other things, but we really need, if your horse keeps getting tight muscles and it's not because you did an endurance ride yesterday and your horse wasn't fit enough or something like that, then you need to find out what is that underlying cause. And as a therapist, I want to make the horse comfortable, but then my next thing is, what can we do to stop this happening? Like, we need to get to the bottom of it. So from my experience as a therapist, and also from working with one of Australia's leading equine lameness professors, these are the common causes that I've come up with. So laminitis and sore feet. Either or both. Obviously, the horse will get sore feet if it has laminitis, but I find that painful feet or sore feet is very under noticed, and a lot of people do not pay it as much credit as they should for causing performance difficulties or behavioural difficulties or discomfort in their horse. And I would challenge you all to, after this presentation, if you're not sure about what I've got to say about that, take your shoes off and go and walk on some stones and just feel what happens to your muscles and your fascia as you do that, and maybe what even happens in your mind. Are you starting to get stressed? It's incredibly important, and I see it over and over again. A lot of owners will say to me, the horse is okay on grass, and I watch it walk on grass and it's not okay. So we really need to look after those sore feet, and there's lots of things you can do. Obviously, there's getting rid of the cause, so the grass or the sugar or whatever, but then you can use boots. If you've got a barefoot horse, you can put pads on a short horse. You can use the surefoot pads. There's lots of things you can do, but that's like my number one cause of tight muscles. So insulin resistance, that needs a veterinary diagnosis, kind of goes along with the laminitis and the sore feet. Azoturia, tying up, or PSSM1, this is again way more common than I think people understand, and is a chronic cause of back tightness and tightness in the pelvic area of the horse. So when a lot of people hear about azoturia, they might think about the horse that's standing rigid in that really stressed position, and you can Google this later, but there's actually much more mild degrees of it, but they're chronic and they keep reoccurring. And that chronic reoccurrence of inflammation and discomfort leads to some considerably tight muscles and fascia. And in my practice, I see a lot of horses that have been through other hands or other professionals, so to speak. And the horse, if someone contacts me and they say their horse has a chronic lower back problem, then I'll ask them what breed it is, because PSSM1 or azoturia is more common in particular breeds and also in particular sports. And quite often I will find when I get there that I think the horse has PSSM1 or has been tying up. So then we get the vet involved.
So Robyn, can I ask a question here? First of all, what does PSSM stand for?
Polysaccharide storage myopathy.
And so you have PSSM 1 and 2 variants. So there's different versions of this?
Yes, absolutely. So they used to be put under one umbrella of just PSSM. And that's up until fairly recent years, actually. Definitely in my time as a therapist, this whole thing has completely changed. So I can't go into it, it's quite complicated. But again, there are websites and places dedicated that you can go and look that are dedicated to PSSM. But it's basically an energy storage problem in the muscular system. And if the horse gets azoturia, then it also can affect the kidneys if it's bad enough. It used to be called Monday morning disease because what would happen was like our work horses, a lot of our cart horses and carriage horses might have Sunday off work and they would be in a stable and they wouldn't move and they would be fed the same grain ration that they were fed for the rest of the week. And that would kick off this problem. So then they would start to work on the next day and the horse would just stop and stand still and be rigid. But they didn't understand then what was causing it. So,
and can you have a horse tie up and not be PSSM?
Yes, you can.
Okay. So because I know with the endurance horses, that's how I met Dr. Harmon. Was we had this horse tie up so bad it fell over, and the two of us she gave it fluids and I did teamwork, and that's how we met. We stood there for several hours. But
a lot of those endurance horses they've since found actually have PSSM1. But it's not necessarily. It can simply be that the horse, like some horses will get will start tying up related to spring grass, particularly mares. And then again, those, race horses that have a day off, don't get out of the stable, still fed the same grain ration, they can still just get that kind of old-fashioned Monday morning disease. But the PSSM is in the Arabians, to my knowledge.
Oh, okay. So is it then genetic?
I don't know enough about it. Okay. Oh yes, of course it is. Yes, yes. They test the quarter horses for it because it's quite common in quarter horses. So I'm pretty sure the American Quarter Horse Association, you have your stallions tested, and you can the public can go in and look at those results. So yes, it is. There is genetic. Of course it is. Okay.
I'm working on having somebody come on and talk about it. I haven't found the right person just yet.
Yeah, it's not me.
Yeah, because it's, it is one of those things that you hear about these letters, but I'm trying to learn more about it. So okay. I'm going to keep, for those of you listening, I'm going to keep working on finding a speaker for PSSM.
So remind me, if you send me an email or something, Wendy, I do know a couple of people, qualified vet scientists that know what they're doing that can talk about it.
Oh, yeah. Awesome. That'd be awesome. Okay, moving on.
Okay. So PSSM2, there's a whole lot of variants of those, and in humans, they would be things like muscular dystrophy. So we don't know enough about them yet. That's why they're called variants. The better the genetic testing gets, the more that they can find those things, but they cause all sorts of strange muscular problems. So it can look like a muscular weakness, it can look like overdeveloped muscles. And but again, if a horse has chronic tight muscles and you've fixed everything else, it's another thing to think about. And PSSM1, and I think there's 4 or 6 PSSM2 variants, can be just tested. That's a blood test now. So you can certainly get those done in the US. We send them over to the US from Australia. So, okay. Arthritis and joint degeneration, I find personally, especially in Australia, there's nowhere near enough emphasis put onto these problems with horses. And if you have a sore joint, now I've just had a hip replacement, so I know all about sore joints. If you have sore joints, your muscles are going to get so tight, and so is your fascial system, just all over the place in all sorts of compensatory patterns, and they can get so painful. So it's really, I'm a great proponent of using things like, you know, joint supplements, and talking to your vet about joint injections, whatever the vet wants to do. It's so incredibly important. A lot of horses are operating at quite a high pain level out there in my experience. And again, the Surefoot's fantastic for those horses. So performance and sport related issues. So that's things like barrel races, just turning the same way around the barrels or in the same way all the time. Or your show jumping horse that is taking off and landing consistently, doing the same thing over and over. All sports will have different related issues, but particularly those sports that do repetitive things, we need to change the way we train, cross-train our horses, you know, kind of unwind them if they're mostly going in one direction. And the fitting of the gear. So an incorrectly fitting bit, bridle or brow band, for example, or an incorrectly fitting tendon boot can cause your horse to be very uncomfortable and become quite tight in the muscles. So it's not just saddles. I think most of us know about saddle fitting these days, but we can forget about all the other kind of gear sometimes. Mental and emotional stress. This is a huge one for horses, domesticated horses. And again, I think we don't understand just how much tightness that can cause in the horse's body. But if you think about your own tightness, like I'm sitting here maybe a little bit stressed about this, so I'm pretty good at talking. You know, my shoulders are getting a bit tight, so just exaggerate that. And afterwards, you know, I might say to myself, oh, just relax, just let those shoulders go. So if your horse is unhappy in its field or its stable with its friends, you know, all sorts of things, you know, if they're fence walking or exhibiting any other behaviours, or even if they're standing around frozen, one of the great term that Wendy uses, then that mental and emotional stress causes a huge amount of tightness in the horse's body too. And then we have injuries, so they can be acute, and the stiffness you get with an acute injury is actually really important, and it's protective. It's a protective mechanism, and it's very useful to the horse. However, sometimes some of that tightness, it just hangs on when we don't need it to anymore. So sometimes you need someone to release that for you. And then chronic injuries, so horses that are dealing with some sort of injury that's not really healing, it's going on and on, you'll get tightness. And then scarring. So scarring is another, it's something that I've been fascinated by for many years, and having been involved in dissections of horses, and I've seen how scars are often like an iceberg. So often with your scar, what we can see on the outside is the tip of this huge structure underneath that often has little tendrils going out everywhere and restricting movement. And as soon as you restrict normal function, then other things will start to get tight. So that's some of my common causes. Ah, but there's more. Oh, I missed. Illness. So I'm sure some of you had a cough or a pneumonia or something. You know how tight your chest gets, how sore your back can be, and how, you know, you often have to do exercises to release that, even years later if you haven't done so. So the same thing for our horse illnesses, and also if they're standing around feeling miserable, feeling unwell. Cushing's, that can be tested by a vet. That's a blood test. It's a bit like growing old early. There's actually more to it than that. But if a horse has Cushing's, so they're the ones commonly that don't drop their coat after the winter. So they're the ponies and the horses you see walking around with a long shaggy coat in the middle of summer. They might have Cushing's. That's one of the symptoms of it, but it will also cause some very tight muscles if you don't manage it properly. Nutrition, again, often gets missed. We nearly all talk about nutrition, but are we getting it right? I've seen significant changes in soft tissues in horses when nutrition is sorted out. Movement. So excessive movement and restricted movement can both cause problems for the horses. So excessive movement is the horse that's overtrained or over-exercised for their age or their ability or their breed even. And also horses that are doing things like fence walking or fence running, or, you know, they're stressed and they can't stand still very long. They've got to gallop over the other side of the paddock and see what's happening over there. And then, of course, we have our horses that are on restricted movement, like these guys here in the stable. So that restricted movement will cause a lot of tightness in the soft tissues. So wasted muscles or atrophied muscles or weakened muscles, muscles that have been damaged, and it could be nerve damage or it could be due to some other sort of injury, though the fascia in those areas will be incredibly tight and dried out. And that will stop that muscle from coming back to full health. So that's something to watch out for as well. Overdeveloped muscles, so they're going to be really tight, and you need to find out why are they overdeveloped. Like, are they compensating for something, or are they doing a job that they're not really meant to be doing, so they've overgrown themselves. Dehydrated fascia. I see this an incredible amount in Australia, and of course in the summer more than in the winter, because horses just get dehydrated, especially if they're doing a lot of sport, or if they're in a paddock or a field where there's only one water source and maybe only one tree for shade, and of course they want to eat 23 hours out of 24, and they generally get dehydrated, and then so does the fascia. But we also see dehydrated fascia due to poor saddle fit, injuries, and those sorts of things. So if you see little like corrugations along your horse's back, or if you run your fingers along the skin of the horse's back and it all wrinkles up in front of your hands like this little wave, then that is dehydrated fascia. I was listening to Professor Kevin Hausler talking about the thoracic lumbar spine recently, and he was talking about the dehydrated fascia and the wrinkles. I'm like, yes, someone else, not just me. And dental issues as another really big cause of tight muscles. If your horse is uncomfortable in their mouth, then these TMJ joints here that often cause us headaches, they will become really uncomfortable and tight and dysfunctional, and then that connects to the whole rest of the body and can cause all sorts of problems. And I'm sure everyone could add their own little idea to my list. All right, so aim for long-term answers. So if your horse has got chronically tight muscles or fascia, or both, they go together, you need to aim for those long-term answers, and that means finding the root cause or the causes. So the things I suggest are a veterinary consult, and they will want to know, the vet will want to know your observations of your horse. So if you can keep a bit of a diary of what's been happening with your horse for a week or a couple of weeks or a month before the vet comes, when they get tight, what was the weather like, what did you feed the horse, what sort of riding do you do, when do you notice signs of pain in your horse, all those sorts of things. The vet will take a history, they might do a lameness exam, they could do some diagnostic tests, including blood tests or ultrasounds and x-rays. I would involve an expert farrier or barefoot trimmer for an analysis of the feet and gait, and to work with the hoof x-rays. Find a well-qualified professional body worker or physiotherapist or whatever you call them in whatever country that you're in. And they should be able to provide you with an analysis of the biomechanics, so that's how your horse is moving, and their posture. And they should also give you some feedback on how your horse feels, like where it feels tight or where it feels loose, etc., and help you with a rehabilitation program. And these three people should all be working together ideally. A qualified instructor or trainer with expertise in rehabilitation and for assessment of the effects of the training that you're doing. So they'll be able to tell you if the exercises and things you're doing with your horse are appropriate, and also for you. So what are your biomechanics like on the horse? Are you assisting the horse? Are you causing it to be tight? I saw a fabulous example of that with Wendy in New Zealand. Do you remember the endurance horses in the indoor arena? Yeah. So one of the endurance horses came in, and I know his bodywork had said he had a chronically sore back and she could never release his back. She would release it, but then as soon as she saw him again a couple of weeks later, it would be the same. And they tried all sorts of things. And then this lady came for a lesson with Wendy, and the other complained about the horses that never stood still. It couldn't stand still and would never walk, it would jig jog everywhere. And Wendy explained to the rider that every time the rider asked the horse to stop, she was actually hurting her horse's back with the way she was sitting. And a couple of really small tweaks, little tweaks of that rider, and the horse was amazing. He was walking around on a loose rein in an indoor arena he'd never been in before, and it was windy and all that. So those things are so important. And that rider was not a heavy rider either. I don't know if you remember her, Wendy, but she was this tiny little super fit lady, but it was just the way that she was sitting was having that big effect on the horse. Mm-hmm. And a nutritionist. I'm really big on getting people who know what they're talking about with nutrition, rather than just buying a bucket of supplement off the shelf. I have 2 horses myself. I don't ride them at the moment, but I still have a nutritionist working out their diet to assess your diet and give you advice on the specific nutrition that you need for your horse. And also they can help you out if your horse is diagnosed with things like Cushing's or PSSM. They can help you out with what is appropriate for that horse, which is really important. And if you're not getting answers and your horse still has problems, keep asking questions. Don't give up. Continuing along that theory, qualified saddle bit and bridle fitters to assess and advise on the impact and suitability of your gear. The bit is so important. Please get it checked. It's really, really important. If you're not using a bit and you're using a halter, make sure it's a comfortable one that's not pressing on facial nerves. And if you're using a hackamore, then again, make sure it fits and it's comfortable and all those things. So qualified dentist. And for the dental issues, it's really handy if you can find a dentist that will actually look at the jaw alignment and look at the whole picture and, not just rasp off a few teeth. Animal communicator, you might not agree with me on that one, but it's something else that I throw out to my owners, particularly if we're struggling to find answers with a horse. Sometimes the animal communicator has some fabulous insights.
And can I say one thing about that? I've used animal communicators, for a long time. Now, I don't use them often because I don't need to, but I have used them. And what I always do with their information is I ask myself, does this fit with what I know? So I think in that case, I use them to verify or give me a direction. And it's been really helpful. And if you don't feel like it fits, then don't do it.
Yeah, that's right. These are only suggestions, but I've quite often when we've gone down that route, or one of my clients has gone down that route, it's been like a light bulb moment. Of course, but why didn't we think of that? So it can be really useful. A little funny thing is a lady I have a huge respect for that I did a clinic with. It's an animal communicator, and I said to her, "What is the question that you get most asked to ask the animal?" And she said, "Do they like their name?"
Oh,
so
wow.
That's the most important thing, apparently.
Wow.
Which is important. Do you like your name? Okay, so you might want to get a trainer involved that can help you identify tension and behavioural issues. So a trainer as opposed to an instructor, and I'm thinking about people like Mark Rashid, that will help you work out where the space your horse is in mentally as well as physically. And yeah, I'm sure you guys all have lots of ideas.
And Robyn, just to point them out, some people have a lot of resources available and other people have very few resources available.
Yeah.
But in this day and age with the internet, you can do research, you can do your own research, you can go out, and there's so much information available if we just start asking those questions and start searching. And I think that's what I hear you saying is, don't just settle. Keep asking questions, do your own research, become the advocate for your horse. And I think that this is the thing that's so important, is that instead of feeling that we're, oh, I don't know what's wrong, and feeling sort of victimized by it, we have to be the advocate. A good friend of mine, when her husband was dying with cancer, she said, he's the patient and I'm the impatient. And, because she kept wanting to know information. And I think that's, even if it's not available for you right then and there are things you can do by going on the internet and starting to look and ask. You can't find it if you don't look.
Yeah. But just a little caveat there, look at the qualifications of the person that's putting the information up on the internet.
Yes, thank you. That's a very important caveat in fact, when I met Brad, who's my guy, he actually went out and checked out my resume first.
Well, good on him. Yeah, so just look at the qualifications of the people, and if you're looking, there are some fabulous Facebook groups with answers too, but look at the qualifications of the moderators and what's being said. We have a group in Australia called Aussie Horse Health and Nutrition, and oh, my hair curls. Just anybody puts in answers in, yeah. Whereas I have a group and it's moderated by myself and another really smart and well-educated body worker, and so we're happy for all sorts of different opinions and ideas, and there's often different ways of doing things, but the really crazy stuff or the really bad stuff, well, we shut that down.
Right. So use moderation in all things.
All right, so what else can you do? You in the meantime, we're trying to work out what might be the cause or causes of the tight muscles and fascia. What can you do to help your horse, and what can you do on a daily basis? So these are not in any particular order. It's just an order I wrote them up. Whatever's comfortable for you. And my motto is always do something. You don't do everything. If you just do one thing a day, it's really useful. Remember, I have a business. I own horses. I travel a lot. So I can't do everything with my horses either. So breathe. Sounds kind of silly to some people. It's kind of easy. It's just breathe with your horse. And when you're around your horses, take deep breaths. Encourage them to take deep breaths. Just breathe. And I will go into this a bit more through the PowerPoint. Meditate. Horses love it if you meditate with them. So if you're someone that likes meditating, or you would like a little challenge to make you meditate, go meditate with your horses. They absolutely love it, and it's very relaxing for them. The bladder meridian, some of you will have heard of that. It's used in a lot of different therapies. Again, I'll go over that shortly. Fascia release, something you can do with your hands. Massage you can do with your own hands. Of course, you can use the Surefoot pads. They are absolutely fantastic. Really, really useful tools. Red light therapy, I'm a big one for using red light therapy. And here I'm putting some tape on a horse that has instability in his stifle joint. So that's going to help release the tight muscles that are holding on to that joint. You can consider changing your horse's living conditions. You can use stretching and mobilization techniques yourself. So baited stretches or carrot stretches, as they've kind of become known. There are so many studies proving that they work, that they're really helpful. And I've, in the last 12 months, heard 3 different spinal surgeons, horse spinal surgeons, say if only if only riders would do baited stretches or carrot stretches, we would be doing a lot less surgeries.
Wow,
So
that's fascinating.
yeah, it's really powerful. It's coming from the top. Hoof boots had sore feet. Please, we don't want your horse walking around all day in the paddock with sore feet, or going down the road for a ride or whatever with sore feet. Increase helpful movement. So if your horse is in a stable and you can't give them more turnout time, take them for nice relaxing walks. Get them moving, get them doing things, or put them in a bigger field, put them with a friend so they can calm down, all those things. Consider postural feeding, which is what my horse is doing here. So this helps to increase core strength and does a number of other things. But if you improve core strength in your horse and back strength, then you'll have a lot less tightness in the muscles because they're just stronger. Tellington T-touch method. So that's something Wendy knows a lot about. And I don't know a lot about, but I love it. It's fantastic. You can buy a book or a video, and it's really helpful. Masterton method, that's another one where you can buy a book or a video, DVD, showing my age here. I was probably filming online now.
I don't think so, actually.
And you can easily learn those things and be quite effective of doing them yourself. All right, so a bit on the nervous system, and I'm going to go through this really quickly because, as I said, this is a bit of a long presentation. So the sympathetic nervous system, it functions under stress and it's responsible for that fight or flight response. It's actually a little bit more complicated than this, and I know that, but just to give you the simplicity of it. So it increases the heart rate, the blood pressure, body temperature, stimulates sweat glands, sends blood to skeletal muscles, bronchodilation, that's in the lungs, and I've already said that, blood to the skeletal muscles. It decreases digestive activity and blood flow to the abdomen. So your horse is going to be in the sympathetic nervous system most likely when it's competing, like this show jumping horse is here, but it might also be stuck in that sympathetic nervous system if it's living somewhere that it doesn't enjoy. And that's why a lot of, like some horses can get reoccurring colics that we don't understand what they're about. It's because they're stuck in this sympathetic nervous system response. And the parasympathetic, that controls vegetative functions, feeding, rest and relaxation. It increases digestion and intestinal mobility, so it encourages them to poo, etc. Fuel storage, resistance to infection, rest and recuperation. It decreases heart rate, blood temperature, body temperature and blood pressure. So you can see that if your horse spends more time in the parasympathetic space, then their muscles are not going to be as tight. And this is a horse in that parasympathetic state. She's having a lovely yawn and starting to relax. So switching your horse into that parasympathetic nervous system, I believe, is the biggest key for releasing their tight muscles and fascia. So once, like apart from finding the cause of the issue, then the next biggest thing is to get them into that PNS, that lovely relaxed state. And my opinion, when I'm talking to owners, that should be the first thing you aim for. And you don't need any specific qualifications to do that. So there are lots of ways. So my favorite is to breathe. So slow, deep breaths and concentrate on your horse. So put the phone away. Don't worry about what your friends are doing in the arena. Concentrate with your horse. Start to breathe a little slower than your horse. And think about your horse while you're doing it. Think about your horse breathing into their lower back. Think about them breathing into their abdomen. So really filling these spaces with air. Because when you're tense, you take little short breaths, and so does your horse. And release the tension as you breathe out. And when you breathe in again, you're filling that balloon inside yourself with love and nurture for your horses. And horses are entrainment breathers. They love to breathe with you. So just helping them to breathe with you is very powerful.
Robyn, are you familiar with heart math?
With
heart math?
No.
Okay, I have the next thing for you to check out, because heart math is actually the science behind breathing through in a pattern that creates what they call heart coherence. And they teach this to people who have had heart attacks. Not all heart attack doctors teach this to their patients, but to and it entrains, and they've actually done studies where the horse and the person have the monitors on, and you watch them basically wind up in the same state of what they call heart coherence. Linda Tellington-Jones' heart hugs are based off of heart math. So it's so interesting to hear you talk about breathing and breathing with that heartfelt feeling, because that's exactly, you'll love heart math. That's the name of the book.
I've written it down. I've made a note.
It's awesome.
So I'm not going to show you this video because it goes for a few minutes. But Sharon Wilsey, who Wendy has had on one of her webinars, or more than one, I think.
Yeah, she was just on Monday.
Yeah, so you can go and look at Wendy's webinars, and I'm sure you'll learn more about. But Sharon is fabulous with her breathing, and I love it where she talks about getting the horse to let go of that last rib or that abdomen, because it's exactly what I talk about too. So, she's just such a cool lady and really smart and great presenter. So there you go. Sharon Wilsey's awesome. So we'll skip over that. So next on the list is to meditate. The other thing about breathing is you can do it anywhere at any time with your horse. You don't need anything. You got to breathe anyway. So
it's free.
It's free and easy. So meditating, I know it's not for everyone. If you don't want to meditate, go back to breathing. You might find you end up meditating with your horse anyway. There are thousands of ways to meditate. All of them will work with your horse. Obviously, make sure you're safe. Don't go sit in the middle of the paddock with 20 horses and meditate with your eyes closed. So go find a method that suits you. And there's lots of horse people that work with meditation. Jenny Pierce is someone who I know very well, and she's in Australia. And she's great at teaching people how to meditate with their horses. She's a lovely, down-to-earth Aussie, very clever lady. So that's just a recommendation of somewhere where you can go for some help. And my horses will make me meditate with them. So where I am with Doc at the moment, it's a little feeding yard area. So they live in a herd paddock. So they come out of there each day to be fed. And sometimes when I'm traveling away a lot or I'm really busy, I'm like everyone, I feed them, I brush them, I put their sunscreen on or whatever it is they need doing. And then I say, off you go, see you tomorrow. And I'll open that gate and they just stand there and refuse to move. And so I have to stop and breathe and meditate. And then they will come over and they'll hang out with me and they'll yawn and sigh and stretch and relax. And either I say, guys, sorry, really have to go. Or they'll say, okay, that's enough. And then they'll sort of wake up, shake themselves and walk through the open gate into the paddock. So they just love it. And they're Arabian and Arabian cross. So if you're more a hands-on kind of a person, then let's talk about the BM, which is the bladder meridian. So I have this picture here for you from I call them the tall Nancy Zadonis. I can't remember the lady's name, but they're acupressure ladies. They're amazing. And the bladder meridian is a traditional Chinese medicine meridian or acupuncture meridian. And this is exactly where it goes on the horse. You can Google. It will treat all kinds of problems in the horse. You just run it really nice and slowly with your hands. I have a video on my Facebook page, Equine Miracle, showing you how to do that. It's also a fantastic thing to do if your horse or your dog is ill or injured or in shock, and you need to do something that's going to help them while you wait for help to arrive. It's not going to do any harm. I have a Labrador who's great at getting into all sorts of trouble and illnesses and things, and the bladder meridian has just helped me so much with him. So that's a hands-on kind of a thing. So make sure, if you can, do both sides of the horse and just use your hands with an intent. So not too light, not like a fly landing on them, but just with an intent, and go nice and slowly. In the Masterton method, there's a great video which you can, I'm pretty sure, find for free on YouTube to watch that. So this one is my video, so we'll skip over that, but you can go and find that on my page.
And we did a webinar recently on meridians on horses with Kim Bauer, so that would be, if people are interested in that, that'd be a great webinar to watch. Yeah,
and that video that I took there that I haven't showed you, I actually did that last year when we had the terrible bushfires and a lot of smoke, and people were asking me what could they do to help their horse, and because the bladder meridian has all sorts of acupuncture points and things on it, and it's relaxing, etc. That was the idea that I came up for, so that's why the video is there. So fascia release, it's my hands-on favorite. This is my really strong area of expertise. So fascia is your connective tissues. Everything has its own form of fascia, and I know Wendy's had webinars on fascia as well, so you can go and look at those. Everything has its own fascia right down to cellular level, so right down to a very tiny, tiny level. And fascia affects the soft tissues, organs, circulation, brain, nervous system, and lymph flow. So it has an effect on absolutely everything. It's everywhere and it connects everything. Fascia will tighten in response to being overloaded. So if the horse has postural changes, or they have poor hoof balance, ill-fitting saddle, etc. It's also affected by illness and nutrition, and it can become really tight. So I talked about that before, tight and dry, or it can become really mushy. So with my hip, as my hip degenerated, the fascia on that side of my lower back and sort of upper thigh, like, oh, it was just horrible to feel it. And fascia will bounce back after muscle therapy and tighten the tissue. So what I mean by that is, if you've ever had a massage and they've rubbed out a few trigger points and things, and they've probably gone a bit hard, and then you feel kind of good for a day or so, and then it all goes to poo again. That's the fascial system. So that if you don't treat the fascia in connection with the muscles, then often those muscles will just keep tightening up on you again. So if you don't like confronting gory things, just look away and we'll tell you when to look back.
Okay. I'll just kind of squint. Oh, okay.
All right. So this is a horse's face. This is under dissection. This horse was euthanized due to health reasons, and then we dissected him. But I just wanted to show here, because I see a lot of problems created on horses' faces. I was talking about that before, how you bridle, brow band, everything's really important that it must fit correctly. So the horse doesn't actually have much muscle on their head. So these white bits here, this is all fascia. And within the fascia here, that is a nerve on the horse's face. So the only bit of muscle we've taken off here is this little thin muscle here. And over the top of that was the skin. So just to give you an idea, there's this really thin muscle, and then you have the fascia with these nerves running through it. So just consider those when you're thinking about your halters. These are nerves running down through here, a little bit of muscle over the top. And all these white bits, this silvery bit here, the nerves are encased in fascia themselves, around the nostrils, all that is fascia. And that's fascia that you can easily see. If you're interested in what live fascia looks like, there's a fantastic video that was made by Dr. Jean-Claude Imboteau, and it's a microscopic video of living fascia in the human arm, and it's not at all gory. You wouldn't know it. Go and look at that video. I've never had anyone watch it that hasn't been totally and utterly mind blown by the vision.
Yeah, it's a really cool video.
Amazing. So you can look back now. So first thing to remember, don't do this if your horse has an acute injury or a chronic undiagnosed injury. Your horse may be using their tight fascia to hold themselves together. So you don't want to inadvertently undo that problem. But if you've had your horse checked over by a body worker or, then fascia release is fantastic. So how do you do it? You just put your hands on the horse. Choose a tight place on your horse, somewhere that feels hard or resistant or lumpy. Set your phone or watch timer for 4 minutes. Then put it away and stop looking at it. Place both your hands lightly on or near the place, so just lightly. No pressure, no squeezing, just resting. If you tighten up, fascia will tighten up against you, and then it won't release. So make an intention to release any tightened tissue and allow it to return to healthy and normal. So you just think that in your mind. I'm just going to release any tightened tissue here, and I'd like it to return to normal and healthy state, or whatever floats your boat, anything along those lines. Take some deep breaths, breathe. Imagine water flowing under your hands, ice thawing, fascia releasing, or just keep that intention to release any tightened tissue to the front of your mind. And when your mind drifts off, just bring it back and really concentrate on your horse. Don't look at your friend in the arena. Don't worry about what they're gossiping about behind your back. Just concentrate and be with your horse. And that's all it takes. So stay in that place till your alarm goes off. And then you can keep hanging out there if you want. You might see that your horse's head has dropped, that they're taking deep breaths, that they're relaxing. So you can stay there for longer. But when you do take your hands away, take them away very slowly. Because otherwise, if you take them away suddenly, the horse will get a startled response and everything will go tight again. Choose another place and repeat. Minimum of 4 minutes, can go for longer. So that's me here working on that gluteal area. And here I'm doing, just if you're going to do this, be really careful. My hand is just resting on the wither and my horse is comfortable with me resting my hand on the wither. If your horse shivers when you put your hand on the wither, then don't rest it there. But this is one of my favorite ways to release fascia, and you're releasing a lot of fascia throughout the body in that area. So it's really cool. 2 hands, rest them on the horse, 4 minutes, rinse and repeat. Easy. So massage, improving mobility. Again, same thing. If you've got an acute or chronic undiagnosed injury, they might be using their muscles and their fascia to hold themselves together. So if, for example, I saw a horse yesterday that's been lame, extremely lame in the right front leg for 3 months, and all the muscles along the left side of her neck and down her shoulder were so tight, incredibly tight and comfortable. So you can definitely massage those. You're not going to do any harm, those compensatory muscles, but just don't go massaging around an injury area. So you can use your hands, or you can go and get yourself a handheld massager like an octopus or a rubber curry comb. That's what I use to massage my horses, the old-fashioned rubber curry comb. There's lots of electric massagers you can buy, and you can freestyle with whatever stroke suits you and your horse. Remember to check in.
Can I ask you a question, Robyn, about, like lately on Facebook on my news feed, there's been these new electric powered thing. And I look at those and I run, run as fast as I can.
So some horses look at those things and go, do it harder. We'll run towards it. So it depends a bit on the horse, definitely. So if you're going to spend a lot of money on one of those kind of devices, I would try and borrow one and check it out with your horse first, or maybe buy a cheaper one and see if they're okay with it. So just like Wendy, there are some horses that won't like them. All horses will like your hands, provided you're doing them in a way the horse enjoys. Mm-hmm. And also you get feedback through your hands. But some people have arthritis, or there's lots of reasons why they might not want to use their hands. So stay off any bony bits, any of those hard, lumpy, bumpy bits. Don't massage them. It hurts. It's not nice. Imagine someone massaging over the top of your collarbone. It's really painful. Stay very light. Touch your eyelid, and however comfortable, whatever pressure you're comfortable with on that eyelid, that's how you begin. Humans often want us to put their elbow in, go harder, do it harder. But horses are not like that. You might be able to work up to that sort of pressure, but they won't like it if you start there. And again, if you're starting with some sort of machine or tool, then start with them on a very low setting. Don't poke your fingers in. Again, horses don't like it. And try to do a region of the body each time. So do both sides of the neck, or both sides of the hindquarter, or both sets of hamstrings, etc. Don't do one side of the neck and not the other one. But you don't have to massage your whole horse either. It just can be really uncomfortable. If you can imagine, if someone came and gave this lovely relaxing massage all around this side of your shoulder and neck and then left, it would be really cranky and uncomfortable.
Well, that's different. When I'm doing Feldenkrais, I'll do one side on purpose to get the brain to pay attention, but that's a different deal.
It is a different deal. Yes, it's very different. And again, same as with the fascia release, never suddenly take your hands away. Here's a little example. I've never used one of these thumper verve things, but looked really cool and easy to use, and nice small unit. The picture of me squeezing down the hamstrings. I've got one hand up here, so I'm feeling the horse. Also, I'm keeping contact with the horse at all times, and just gently squeezing down those hamstrings. And this here, I'm using my knuckles or the back of my hand, just in a wiggling motion. You can knead, you can do anything, just don't poke them. And you can see here, this is Morocco. He's a Andalusian stallion. Isn't he beautiful? Yeah. And you can see the lean on him. Look how he's leaning in.
Yeah. So that brings up a great question. It's like, how do you know, like when you're doing some massage on your horse, if the horse moves away, should you, or does the horse lean in? Like, can we get some clues from the horse about how we're doing?
Yeah, it's a great question. And absolutely. So you can see in this picture, Morocco's head has come down. His nostrils are dilated because he's taking those deep, relaxing breaths. He's leaning into me. That means he's enjoying it. If the horse moves away, and they're not just moving away because they got a fright or a fly bit them or something, then you need to change your technique or go to a different place on the horse. So you're looking for the same things you would look for with the surefoot. You're looking for the horse relaxing, so the head dropping, the slow eye blinking, yawning, licking and chewing, sighing, taking deep breaths. All those things tell you you're on the right track. But when you first start out massaging or doing some fascia release, you may not get those responses to start with. So as long as your horse is not kicking at you, biting at you, twitching under your hands, moving away, or any of those signs that they don't like it, then you can keep going. He's such a beautiful horse.
Yeah.
All right. And the best massage stroke is the one that's comfortable for you and your horse. So Effleurage, I give this to people a lot because it's really easy to do, and it's literally just, I'm going a bit fast, so just stroking one hand and then the other one. So stroking And you can do that over the whole horse, down their legs, everywhere, wherever they're comfortable. And it shouldn't wear you out either. So kneading, the kitty, you know, the kitty needs you, the cats need you, just a little rolling over, but not pokey fingers like the cat has. So cupping, compression, so that's just using your hand a bit like a cup and just on and off. That's quite a nice one too. Mobilization, so being a little caterpillar, inching your way along through the tissues, mobilizing those tissues. Remember, stay off the bony bits, stay light, don't poke, and do a region. Oh, so immediately looking side. Where did I get that from? And notice I've got the new one too.
Yeah, I do.
So many of our horses have sore feet or pain in their hooves. And if you relieve that pain, you will release the tight muscles and fascia. And the Surefoot is absolutely gloriously fantastic and amazing at relieving pain in horses' feet, provided you use them as you're meant to. So please watch the guides on how to use the pads when you buy some. Don't make assumptions about your horse. So they will release so much tension from the feet up. And I think in my clients, Wendy, I have about a 50 or 60% uptake of if clients that actually own Surefoot pads.
Wow.
So they have me coming to work on their horse, and then they use the Surefoot as well. So as a therapist, I found the Surefoot has saved me a lot of work, physical work, because I can stand the horses on the pads and a lot of things just release and disappear. So I don't actually physically have to release them. So as well as relieving pain in the feet, they just release things, and they put the horse into that parasympathetic nervous system as well, which is so important. Yep, trust me, you won't. None of my clients have tried to sell them again on eBay yet.
Well, and you know, it's so funny you said that, because I've had people occasionally ask if there's used pads, and there aren't. They're just, you know.
Yeah, it's like the red light therapy wraps. You can never buy them secondhand either. People buy them and they use it. Yeah, so we get increased in circulation in the feet and the limbs. They allow the horse to rest in comfort, and that again is incredibly important. They initiate that wonderful parasympathetic nervous system when everything is going to relax. They improve balance and reboot lost neural connections. So that's going to help release tight muscles, because if your horse's balance improves, then they're not using their muscles to try and keep themselves in balance. Everything is working in a functional way. Follow the instructions. Yeah, don't overuse them. So follow the instructions and be fine. Oh, here we go.
Oh, how cute.
So you can see this was at a clinic in Queensland. I teach a clinic called Stretch to Strength, which does, teaches owners how to do those kind of things. And I take the Surefoot pads along. This horse had never seen a Surefoot pad before. She's having a first stand on one, but you can see she's starting to relax. But also, I just love this owner. First time, horse has got 1 foot on the pad. Look how relaxed the owner is. That's really helpful for your horse. Your posture and your breathing is really helpful for your horse. This is my horse, Doc. So he's doing some carrot or baited stretches, but with some hay. He's standing on his Surefoot pads while he's doing them, and his nose is orange because it's dyed with henna as a sunscreen to stop his nose burning.
Oh, wow.
And that's why his back socks are dyed as well. That's what that is.
Okay, yeah, I'm glad you explained that, because
yeah,
I was trying to figure out if he put his nose into something that was orange, but
yeah, a lot of people think it's turmeric, but
yeah,
it's henna, the natural hair dye.
and it helps, huh?
Yeah, because especially if you can't be there every day, or your horse hates having the sunscreen put on, or can't wear a mask to keep the sun off, then the henna hair dye will work for, you know, a week or two before you have to replace it.
Wow.
Yeah, and there I'm forcing him to stand on the short foot pads. And he also has, these are Equistreams magnetic bands. So Doc has a bit of arthritis, and they also help with some pain relief. And then again, ergo, less tight muscles. And it's just another picture of a horse. Again, like he's really relaxing on the pads. He's on stacked pads, and you can see the eyes are closed. His face is really soft. There's no tension in his face, and you can hardly see a tense line in his body. So yes, he's a bit overweight, but there is virtually no tension in this horse's body, and that's because he's standing on the short foot pads and he's nice and relaxed. So that's pretty cool. So red light therapy, you can target it to specific acupoints, and there's lots of courses you can do for that. Or you can just use it non-specifically on areas that are tight and sore. I think we're running a bit short of time, Wendy, so I might just skip over what it actually does.
That's fine. Maybe, you know, that's something that would be interesting to talk about at another time.
Yeah, so, and you can go and Google, there's a lot of scientific research now. It's proven how it works. I think we still don't know the entirety of how it works, but there's plenty of scientific proof. So red light therapy, it's something, here we've got Devious. He has a red light therapy wrap sitting on his back here. My actual client for the day is Belly, this horse. Devious is retired. So there's a whole story about Devious on the short foot pads, which I'm going to tell at my clinic, but he also used to come over and he used to get short foot therapy and red light therapy while I worked on his mate as well. So again, demonstration that parasympathetic nervous system at relaxation, he's yawning, his eyes are closed, his head is down, he's really enjoying it. And the red light therapy will also help injuries to heal. Reducing stress. It's a key to all body systems. Can be simple changes, can be incredibly powerful. I really urge you to look at your horse's living conditions and training conditions, etc., and just see what changes you could make. So offering that opportunity for more movement will usually create more relaxation. Avoiding repetitive movement, providing another horse or even more than one horse for company. We quite often in Australia, we have a lot of places with small acreage and they buy one horse to be a friend for their horse, but it's not actually the horse's friend. They don't get along. So sometimes it's handy if you've got two friends for your horse, because then you've got a little herd and they're often a bit happier that way.
And just to speak about track systems, because I know that it can get super involved. I just got some pigtail sticks last summer and put them in the paddock. And the weird thing is I didn't block off the shed, but the horses used to live in the shed. And now they never go in the shed. They are moving and they have to go. I've made it so they have to go into the second field for water. And so then they gallop all the way back around to come to the gate. So at least once or twice a day, they're getting a nice, but it was so little that I did. It made such a huge difference. I was shocked.
Yeah, wow. That's incredible, getting them out of that shed. So I don't mind them being in a shed for shelter, but not just standing in a shed all day.
Standing there day after day after day.
Yeah, I have lots of clients in Australia that have small acreage and, you know, they build a track, and a lot of them have done it like you have with tread-ins or pigtails and some tape around the outside of the property and giving them access to different paddocks at different times. And the other thing we've seen is the huge changes in the weeds, because the horses, they're not allowed, because they're led into different paddocks at different times and they're not stuck in that paddock grazing all the time. And it's like a kind of a form of cell grazing, I guess. But, you know, and then you can put different things in the track to mimic being out in the wild, you know, logs and rocks and all sorts of stuff. Give them water to play in.
Yep.
So
no, is the horses weren't as smart as we thought. It took 4 months to figure out how to get from the water back around to the gate when we showed up, because they tried to come direct and they had to go around, but they did finally figure it out.
Well, see, there you're helping them to learn.
Yeah,
so that's
absolutely.
So if nothing else, especially if your horse has to be on stall rest or yard rest or something, then providing toys and other stimulus, and that's a whole nother topic as well. But just there are so many things you can do, and a lot of them are very inexpensive. Ensuring your horse is not over or under rugged, that's a really big problem in my country. I see horses that are sleep deprived because their rugs are too tight. They won't lay down
blankets in this country.
Yeah, until the rug is taken off, for example. Horses that are so hot, they just go and hide in the shade all day and don't move.
Oh.
And then horses that normally have a rug on and then they're not rugged and they're freezing. So I find the easiest thing is my horses don't wear rugs, and then I don't have to worry about whether they've got the right one on, whether it's fits, whether it's rubbing their shoulders, whether it's, yeah. But I can do that. I know not everyone can do that, but I can do that. So it's an easy way. If you're struggling with the whole idea, just don't have a rug. End of story. Here's some Icelandics. I took this picture when I was in Iceland. No shelter, no rugs. End of a very, very cold and long winter. I don't agree with them having no shelter from the wind, I must say. But you can see they're in good nick and they've herded together to keep, and they've got their bottoms to the wind. So they have natural coping mechanisms as well, if we allow them to use them.
Yep.
Think yoga, stretch, mobilize and strengthen. So those carrot stretches, yes, they do work. Hilary Clayton is someone that's done a lot of research into that, but they only work if you do them.
Yeah.
You just feed the horse the carrot and go, I'll do the stretches tomorrow. Yeah, they don't work. I've got lots of videos on my page, and there's lots of other videos and things out there you can look at. The only thing I will say is don't ever do the one where you bring the horse's nose to their chest. Hopefully you can see that.
Yep.
So there's quite a lot of books and videos, and they telling you to bring the horse's nose to their chest. Never ever do that. When you do that, you actually have to compress the horse's spinal cord to get it into that position. It's not a natural position for a horse, so don't do that one. When you bring the horse's nose down and between its front legs, make sure you go below the knee. If you go below the knee, you're not going to compress any spinal cord.
Good advice.
Yes, and it's a real shame that it seems to be accepted to go there. It's biomechanically very wrong. So gentle mobilization techniques such as rocking, again, you can Google that, spinal rocking, you'll find lots of stuff, and that's a lovely way to help the horse too. Suitable pole work, so walking over poles is another thing I give my clients to do, but it needs to be appropriate to your horse. So you need to get some advice on what's the right sort of pole work, and I prefer to do it in hand, or do it in hand for a long time before I ride the horse over poles. Give them the freedom to do it correctly. And if you do all three of those things, some carrot stretches, some gentle mobilization techniques, and some pole work every day, your horse will change and it will improve. And if you strengthen them, then and you get everything moving and mobile, then their muscles will be a lot less tight. So working them over different terrain, so go on the grass instead of the arena, so get them out of the shifting sand, not working on super hard surfaces all the time. Just cross training is really useful for tight muscles. And doing different exercises. So I'm sure we've all seen the person that rides the same 20-meter circle in the arena. I've literally timed people. I timed one lady a while ago. She had 25 minutes on the same rein, on the same circle in the arena. And I'm sure she had no idea it was that long. She probably got lost in time trying to make that perfect circle, but it really doesn't help. It just makes your horses so tight and sore. And think about doing some little jumps if you're confident enough and your horse is okay. Even Grand Prix dressage horses can do jumping.
There used to be tests with jumps in them.
Yeah, there are some tests with jumps, and just maybe not Grand Prix level, but they are there. I've even judged some of those, and they can be very exciting.
Yeah, I bet.
Wading, in water at the beach. Try some working equitation. That's a good mix of skills for horses. Mix it up. Do different things. So this young horse here, this is another one of my clinics. This was her very first time away from home, and it's her very first time walking over poles. And I just love this picture and this pony and the owner, Catherine, is fabulous. So here we have activation of the muscles in the neck for balance. So this horse's head is not falling down. She's not on the forehand. We've got lovely mobilization of these joints, so she picks up that front leg. We've got nice stabilization muscles activated here. We can see she's activating her core a little bit, and she's lifting up a little bit through the back, and that's because her head's down. She's not on the forehand, and she's actually lifting up. We haven't got a hind leg in the air because she's walking, but you can see a nice stretch through these muscles, and the activating muscles or the stabilizing muscles in this limb are being well used. So I love walking over poles. Doesn't have to be anything amazing. Just having a horse walk nicely over poles is a hugely beneficial exercise. Hoof boots. So sore feet equals tight muscles, absolutely guaranteed. Guarantee it. Got sore feet, gonna have tight muscles. Try walking around on some stones. And if you thought that was not that bad, I challenge you to go out there the next day and walk around on some stones bare feet, and then see how your feet feel. So the hoof boots do a whole range of things. They're not just for riding. Your horse can wear boots in the paddock as well, or the field if they need to. And there's so many different types of boots. Make sure they fit your horse. That's very important. There's lots of advice, and ideally you would get a professional hoof care provider to fit your boots, but there's lots of online resources again for fitting boots. So that leads us to helpful movement, and again, it's a really big point. So movement in comfort, so not hobbling, not limping, make sure they're moving in comfort. It's also functional, so they're not dragging their hind toes in the sand as they go around in the circle, for example. That's not functional movement. The more movement, the better, so long as your horse is comfortable and it's okay for their fitness level. Hand walking in a pleasant environment can change the world for your horse. I've had so many clients where we've put them back to just hand walking for a couple of weeks to allow the horse to recover from whatever it is. And at the end of those couple of weeks, and I go back, the clients, 90% of them will say to me, I have a much better relationship with my horse now. And we've so enjoyed our walks, and my horse is, less spooky at things, etc. So it's a great exercise. Lunging can be helpful if it's done well, but it's very rarely done well, and if you're not drilling it every day. So lunging is an absolute art form. Sure, Wendy would agree with that one.
Yeah, no, absolutely. Absolutely.
Really hard to learn to do properly. You really need someone who's really good with lunging.
And you have no idea, if you're not the one at the end of the lunge line, you have no idea how many steps are happening in a minute.
Yeah, true. I hadn't thought about that, but yes. Yeah. So it has to be done well. It has to be done with a purpose other than just running around in circles. We have to be looking at balance and shortening and lengthening and moving in and out and all those things. So get yourself some training from someone who does it correctly. So more paddock space, paddock time, paddock paradise, or a track, and daily rides that are suitable for your horse's fitness, assuming all the other things are okay, are really going to help your horse because it's getting them out and getting them moving. So postural feeding, that's kind of a term that's coming into use now. Again, Sharon May Davis, my friend and our Aussie scientist, has done a lot of work on postural feeding and hay-high and grazing options and how they help horses. So There's a video on my Facebook page, so I won't go in too much detail, but it's not necessarily that hard to do. So I showed you a picture right at the start of Wishes, my mare eating a hay net hanging on the yard up high, and she's standing nice and square. So here she is again. I took this not all that long ago. So this is postural feeding. She's got her feet up a little bit higher and she's eating up higher. So we need horses to be eating off the ground, which generally in Australia they do a lot of, but we also need them to be eating at other heights. They're meant to browse on trees and shrubs and do other things. And by targeting your postural feeding, you can really help strengthen and stretch your horse at the same time. And yes, I know she's fat. And there's lots of other stuff. So taping, fascial taping, you need someone to show you how to do it, but you can do that yourself. You can do lots of things with that. I teach for Tysol in Australia. Tellington touch method, Masterton method, you know, I particularly like those because there's really a do no harm kind of ethos, and they have books and videos or DVDs and things you can look at. You don't have to necessarily go and do a course. And on the neurological side that we talked about right at the very beginning, the T-Touch, they've got a lovely book on neurological rehabilitation. It's not very expensive, and I highly recommend it if anyone's got those sorts of issues. Yeah. So over to you and your horse. We're done. Oh, marathon.
Wow, we have covered a lot of territory.
Yes, we have. So really the idea is give you an idea, and then you can go and follow up with something if you're interested in it. I do have an owner's online horse bodywork course. If anyone's interested, they can contact me through my page, where you learn the very basics of massage, fascia release, joint mobilization, all these things that we've been talking about, as well as a few more things.
That's awesome. And, you know, I just love the fact that you've, like, something as simple as breathing. Everybody breathes. You know, so it doesn't have to be complicated. It doesn't have to require a lot of equipment. It doesn't have to be something so in depth. Just get started, I think, is the message here, is just do something. You know, just put your hands on, or just stand by your horse and breathe and help them breathe. And then just that puts us in that parasympathetic place, so that we can then start to become more observant and notice what's going on and see these different things. Because when we're stressed, we can't see them.
No. And it's really hard if you think you've got a problem with your horse and you don't know the answer. It's very hard to not be stressed when you're around your horse. I know what that feels like. And, you know, I get a lot of trainee therapists, or, you know, therapists that would like to learn some more, that might come and spend a day or two with me occasionally, or therapists that I'm training. And the horses don't respond to them particularly well initially, and nearly always the key is their breathing. So I've just, over the years, and I was doing this when I was riding and training as well, when I go to a horse, first thing I do is a couple of deep breaths, huff them out, like just breathe with the horse, look at the horse, I just stand there, and then, you know, I put a hand on or whatever. And it's taken me years to work out that that's the main thing that's going wrong with these other therapists.
Well, and you know, that doesn't surprise me, because I've, you know, when we're learning something new and we're trying to learn a technique, the tendency is to tighten, right? To hold our breath. We're concentrating, we're focusing a bit, and then the horses are like, ah. And so, but there needs to be that moment. We need that moment to kind of like be able to learn it, but we know we've got it when the breathing returns. And I always think, like with riders, that the breathing is going to get held during certain learning processes, and it's when it returns that we know it's really kicking in.
Yeah.
Right. And then as a teacher, you can watch your students and you see them, oh, they're not breathing. Okay, they're still in that phase of trying to figure it out. And then as we become more comfortable, the breathing comes in again, you know, it's so fascinating. I think breathing is something that I've seen a lot of riding instructors yell at their students to breathe, and what happens is they can't. So it's a really fascinating thing, and I found that if I observe it, but you know, in my students, but without necessarily putting their attention on it, but seeing how it shifts, it's just fascinating. So thank you for bringing that up, because it is really a fascinating thing.
Yeah, it's very powerful. And I think too, as a therapist, and as like I'm pretty good now. I'm pretty confident now. Well, I'm very confident now, but it took me a lot of years to get there. And I think a lot of our therapists, body workers, etc., they're all the same. They desperately want to help you and your horse, and they're desperate to do their best, and they're, you know, worried they mightn't be able to help you. And so, of course, that can create some tension in them. So, yeah, I found that the breathing is, and sometimes too, like when I'm working with a horse and someone's holding it, and there's a bit of tension coming down the line.
Yeah.
I'm like, just breathe. And the person will look at me and, man, I'm like, just breathe. And then you see them, they just go, oh, okay.
Yeah.
The horse is like, oh, it's okay.
Well, Robyn, this has been fantastic. Thank you so much for joining me tonight.
That's cool. Hope it's been helpful. And yeah, anyone has any questions, they can jump over to my page at any time and yeah, ask me a question.
Awesome. Well, thank you so much for joining me tonight. And just let me know how your workshop goes. I'm sure it'll be fine.
Well, yes, I'm sure it will be too, but I'm that person who likes to have everything organized before.
Yeah.
Yeah. And then I'm good. Okay. All right. Bye-bye.
Thanks, everybody. Bye.
Yeah.